Audiology and hearing health is the topic of today's discussion on our show today, and we've got a fantastic panel of folks to share their knowledge and their experience. We're joined by Rob June, who is a clinical audiologist, got his education at University of Wisconsin-Eau Claire, Western Michigan University at Kalamazoo, and Salus University in Philadelphia. Terry Walling, who is a hearing instrument specialist and certified occupational hearing conservationist, and Jason Nuttall, who's an athletic trainer, but will be talking about his experience as a patient of audiology today. From the Mile Bluff Medical Center here in Mauston, I'm Justin Riley, and this is Wisconsin Doctors. Welcome back to Wisconsin Doctors. We're talking audiology and good hearing health, specifically the audiology team here at Mile Bluff Medical Center. I'm joined by a great panel of folks, couple of returning folks, and then somebody new as well. So Rob June, Terry Walling, and Jason Nuttall, welcome. Good to have you with us today. So, Rob, I'm going to start with you because you're our panel audiologist today. What is audiology, and what does an audiologist do? What is their job?
Great question, Justin. Audiology is the study of hearing, balance, and other ear-related disorders. An audiologist is the expert who helps diagnose, treat, and prevent hearing and balance disorders for all age groups. The type of work settings that you may find us would be in the hospital settings, such as Mile Bluff, ENT offices, schools, the VA system, colleges, private practice, and rehabilitation centers.
Okay, excellent. And I think it's important for viewers to know that although you guys work closely with ENT doctors, you are not ear, nose, throat doctors.
That is correct.
That's good to know. Terry, welcome. First time on Wisconsin Doctors. Good to have you here.
Thank you.
You are our hearing instrument specialist. That sounds like such a glamorous term.
I know. I enjoy the term. What I am really is we're a group of individuals. We have had to pass a practical and a written exam, and that's administered by the state. We're able to do hearing evaluations in the adult population over 18. We can also do hearing aid consults. We can do hearing aid fittings. We can do ear mold impressions. And we can also do the follow-up and the adjusting of hearing aids once we have fit our patient with the hearing aid.
So it sounds like you do a lot of the same things that an audiologist does, but you are not an audiologist. You work with the audiologist.
Correct. I work with them. Right.
So how does what you do fit into that team of working as a team with the audiologist?
Right. Some of the things mentioning teamwork that we do is if we ever get hard to test adults, we work in pairs. We also work in pairs for young children. Sure. Hard to test young children like that as well. I can also act as an individual and do the hearing tests myself. I also do repairs of hearing aids. Anything that comes in that a patient has a question on, or programming, or general repairs of hearing aids, I do them as well. So we all kind of work together in different aspects of the
That's very good, and there's a very strong sense of team here at Mile Bluff, which I think is important for people to know. Jason, welcome back to Wisconsin Doctors. Good to have you with us. And you are one of the athletic trainers here at Mile Bluff, but you're actually here as a patient. Right. So talk to us a little bit, give us a very brief background of what brought you to the Mile Bluff Medical Center Audiology Department.
Well, I have actually quite extensive hearing history. I've seen ear, nose, throat specialists for many years. So I've worked with audiologists throughout my hearing issues. Sure. And when I started working here at Mile Bluff 9.5 years ago, I actually started using Mile Bluff services and working closely with audiologists like Rob, and now I work with Terry quite a bit when I have issues with my hearing aid. Okay. I have hearing tests frequently. And they work closely with my ear, nose, throat specialist as well as my regular general practitioner to determine whether or not I have any issues that may need to be addressed.
I think that's so cool because, I mean, you say that they work well with your general practitioner, and I mean, they're almost literally right down the hall from each other.
Right.
So that's just really, there's a real sense of team here, again, as we had said before, and we'll
Very
talk
much.
about that later on the show, so awesome. Well, when we come back from break here on Wisconsin Doctors, we're going to talk a little bit about health conditions that could potentially lead to hearing loss. So you won't want to miss that. Stick around, there's more Wisconsin Doctors coming up after the break here at Bluff Medical Center. We've been talking audiology and hearing health here on Wisconsin Doctors at Bluff Medical Center. And now we're going to learn a little bit about some of the health conditions that can lead to hearing loss. So Rob, June, I'm going to pose that question to you. What are some of the health conditions that can lead to hearing loss?
Great question. There are a number of health conditions, but some of them include diabetes. So patients who have type 2 diabetes are twice as likely as the general population to have a progressive hearing loss. One would also be cardiovascular disease. So poor hearing, or excuse me, poor heart health leads to poor blood flow within the inner ear.
Wow, okay.
That can restrict blood flow within the inner ear, causing a progressive hearing loss. Also, individuals who have diagnosed hearing loss are 3 times more likely to experience falls. There's also a link between dementia and hearing loss, and also a link between depression and hearing loss. There's also some cancer treatments. Some cancer treatments could cause, or there's a link with or side effect of hearing loss for certain types of cancer treatments.
Okay, interesting. And you know, the thing that popped out to me was depression. I mean, and that makes sense. It's nothing I never thought of, but it makes sense because not being able to hear and converse with people can be very isolating.
Very much
It
so.
makes sense. And it's interesting that, you know, people don't often think that things like cardiovascular disease and diabetes can lead to hearing loss, but it's something that really can. And I guess my follow-up question to that is, if somebody is diagnosed with any of these conditions, is hearing loss inevitable or is it preventable?
Good question. So for most of these, hearing loss would be preventable. For example, for diabetes and cardiovascular disease, if we take small steps to manage these, such as proper diet, physical activity or exercise, and quitting smoking, it could reduce the effects of progressive hearing loss with those 2. Also, it is important to have your hearing tested by a licensed audiologist or hearing instrument specialist, and if you do have a diagnosed hearing loss with appropriate amplification, it could reduce the risk of falls because you'd be more aware of your environment. It could also reduce the effects of dementia or Alzheimer's disease. And then also, if you hear well, you would be more likely to engage in conversation, which would reduce social isolation.
Right.
Also, with certain kinds of cancer treatments, chemotherapy, some of them, you know, there's a possibility it could be preventable. It just depends on the type of chemotherapy used and the link that you were on it.
Okay, so it sounds like some of them could be preventable, specifically with, you know, cardiovascular, diabetes. Those things, if caught early enough, it's totally preventable because those things are very manageable.
Correct.
So that's good to know. Jason, we just have a few seconds left, but I'm wondering if you can talk a little bit about the quality of life aspect and how utilizing hearing devices has affected your quality of life.
It's dramatically impacted my life because I can actually have a one-on-one conversation. I can talk to my kids and some newer devices allow me to hear the kids in the back seat, which is really neat because otherwise I'm always looking back. Or
You don't have eyes in the back of your head, but you have ears in the back of your head now, so that's...
Right. I'm not a teacher.
Right.
But just things like that really new advances make a lot of difference. And working with people like Rob and Terry really can help us decide what types of technology we need to use.
Yeah, and sort of what your quality of life, what you want to be able to do, and then the technologies can sort of follow that. This would be best suited for, the type of line of work that you're in or working with kids and that sort of thing. So, excellent. When we come back, we're going to continue talking about hearing health and audiology here at Bluff Medical Center and Wisconsin Doctors. Don't go away. Okay, so we've learned a little bit about audiology, and we've learned a little bit about some of the health conditions that could lead to hearing loss. And now I'd like to ask Terry, what are some of the occupations you typically see a higher frequency of hearing loss in its workers?
Okay, Justin, well, what we do, we have hearing conservation in the workplace. It's a program that I represent.
Sure.
And we go into the different factories and we do testing of the employees. And what we tend to find is in this area there are a lot of factories, and we go in and we test them, and that seems to be probably the highest group that we will find a noise-induced hearing loss is in the factories. Another area, the reason would be because of the loud machinery, the grinders, the cutters, things like that, and this exposes the workers, even if they wear ear protection, as well, to potentially dangerous loud noises.
Yeah.
So we kind of keep an eye on that, and we will test them. Another area also that we notice in our area would be farmers.
Sure.
Yeah, farmers are another group, tractors and loud noise and things like that. And one other one we noticed too, recreational hunters.
Interesting.
This is an area where people hunt a lot, and they'll come in for screenings and we'll notice, due to the ammo.
I can imagine that the latter two groups that you mentioned probably don't wear hearing protection as consistently as perhaps a factory worker would.
Right.
They're a lot more exposed to that.
Right,
noise level.
and hunters, and we can understand that a lot of times they don't want to wear the ear protection in the field because they want to hear everything around them. They don't want to miss.
Yeah.
The
Hey,
big
there's
kill.
a buck. Let me put on my.
Yeah, right. They don't want to miss the big.
Oh, I missed it. So.
Right, right. So yeah, we did notice that.
Right. So now you talked a little bit about hearing conservation in the workplaces, and this is where you actually will go on site and test people's hearings and kind of figure out what the needs are. Can you elaborate a little bit on that, and what all do you do when you're making a visit to the workplace?
We can actually go to the workplace and visit. We also, on occasion, will have the workers come in to us.
Okay.
So we can do either one. And we go in and we test the workers. And we'll counsel them and we'll keep records and we'll test them year after year and look for changes in the hearing. We also show videos on good hearing protection, and we'll also talk with them and work with them on inserting and the best ear protection for them, for their job.
Okay.
Yeah.
So it sounds to me like that's not just a one and done thing. You're working with them over a course of time that's more than a day at least.
Oh yeah. I mean, depending on how long it takes to get through a factory of employees, and then we will go back annually.
Right.
And then we keep records from year to year, and we watch for changes. And we do counseling and things like that.
Okay. And we've had a chance to talk before the show a little bit about how there are some companies that offer that hearing testing from a mobile van. So here's the million-dollar question. Why should somebody choose Mile Bluff over a company that does it via mobile van?
Absolutely. Great question. And what we do different than the mobile van. Now the mobile vans will travel from state to state or factory to factory, where we'll go in and give the employee specialized testing. We test one-on-one. We do otoscopic eval, so if there's any kind of a problem with their ears or the ear canals, or they have wax in their ears and we're not able to test them, then we can retest them at any time. So we'll give them individualized counseling.
Sure.
And we care, and we get to know our people year after year. You get to know the person, and it makes it kind of nice.
And how does the process of utilizing Mile Bluff's hearing conservation program initiated? What are the first steps that need to be taken?
Usually we'll get a call from the company, and they'll want us to take a look at what they have and what we offer is hearing conservation. So they'll give us a call, we'll go in, we'll talk with them, we'll see what their needs are. Some of the factories, we don't have to perform an entire hearing conservation program, they only want certain parts of it. So we'll go in and we'll do the parts that they're requesting and help them through that.
Awesome. When we come back, we got to take a short break. When we come back, we're going to talk about how the audiology team here at Mile Bluff really works as a team within the whole umbrella of Mile Bluff Medical Center. So don't go away, you won't want to miss it. It's right after the break here on Wisconsin Doctors. Team effort is the name of the game here at Mile Bluff Medical Center, which is what we're going to be talking about next. Up until this point, we've learned a lot about audiology, hearing loss, and hearing protection, good hearing health with our panel today. And Jason, I'm going to turn to you for a moment because you're our patient here today. Tell us a little bit about your experience as a patient of the audiology department here at Mile Bluff Medical Center.
Well, working with the audiology staff here has been really good. I can walk in or call the department and talk to any of the audiology staff and know that I'm going to get an answer. If they can't answer it right then, they'll talk to the next person, or they'll collaborate with each other and say, have you seen this, or have you heard about this? Sometimes I have issues where I walk into a different environment with my hearing aid and I all of a sudden have really bad feedback.
Sure, yeah.
I'll call them up and say, can we adjust this? Is it something we can fix, or is it something I just have to deal with?
Right.
And they'll take the time and sit down and work it through with me.
Sure.
Or if we adjust something, they'll say, why don't you try it out and let me know in the next couple of days how it worked.
Yeah.
And having that, the ability to talk to Terry, Rob, or even Dan, it doesn't matter if they're on vacation, the other ones can pick it up. And
sure, yeah.
I may see Rob more, but Terry knows what's going on. She can help me too.
Yeah.
Dan can pick up where Rob left off too.
Right.
So it's really nice.
It kind of sounds like it's not one of those things where, if Rob's on vacation and you're seeing Terry, that Terry has to look at your file for the first time before she sees you. They all sort of know what your needs are and what you've been through thus far, and can kind of make a better decision based on you as a person and not just what they read quickly in a file before they see you. So that's huge, I think, too. And you talked about, obviously you have the privilege of being able to walk down the hall since you work here and talk with them.
Yes,
but
I do.
I want to make sure that the people watching right now know that they're just a phone call away. And if you call and leave a message in the audiology department, you get a timely response no matter who's there on staff. So they're very good about responding. So, Rob, obviously we've been talking about team effort here. There's a strong sense of team within the audiology department, and then there's also a strong sense of team across the different departments here at Mile Bluff Medical Center. So I understand that you work with some pretty specific specialties. Can you share what those are?
That is correct. Well, as Jason just mentioned, our audiology team includes Terry, hearing instrument specialist, my coworker Dan, who's also a licensed audiologist, and myself. We work here at Mile Bluff, but we also serve 3 other clinics, such as Mountain View over in Friendship, the Lake Delton Clinic, and the new Lisbon Clinic. And then we work closely with primary care. The specialties that we also work closely with are ear, nose, and throat to help diagnose hearing loss so they can properly treat them and manage them. We work closely with the speech pathologist here for diagnosing hearing loss so that speech and language intervention can take place promptly. We work with the physical therapy department for those patients who have dizziness or vertigo. And then we also work with cancer care for those patients that are on chemotherapy. We do a baseline hearing test and then periodic checks to see if there's any changes with their hearing.
Boy, Rob, it sounds like you could have just answered what you said by saying all of them. You work with all of the departments. Terry, you have some folks that you work with too.
And I jump in as well.
Yeah.
I work with our OB department.
Okay.
What we want to do, it's part of the standard of care that we work with all newborns and do hearing screenings.
Okay.
So
Yeah.
I do that as well. And then I also we do health fairs several times a year in different locations. And so what I'll do is I'll go along with the health fair and I do the free screens. So we can screen anyone who wants to come in during the health fair times, and we do list them out in the community. And I can do free screens for those as well.
Now, being a recent dad, I've had Terry test my children's hearing, and it's amazing that they can actually tell without I have to push a button every time I hear a noise.
Right, yeah.
Well, a baby's not going to be able to do that.
It's a common question. Everyone wants to know, well, do they have to raise their hand? And my thing is, no, they don't have to raise their hand. Thank goodness the eardrum automatically responds.
Right.
So,
It's really interesting to see that you can test hearing.
Without having to.
Yeah, without having to raise your hand or press the button.
Right.
So, Jason, I'm going to let you get the last couple of seconds here for final thoughts. If somebody lives within the Mile Bluff Medical Center or one of your clinics and suspect that they may have hearing loss or feel like they might need to get tested for hearing loss, why come here versus, there's other options for places that they can go. Why come here?
I think it's really important to see somebody that has access to your other providers as well as other specialists.
Yep.
Terry, Rob, and Dan, they've all talked with my specialist at UW.
Yeah.
Or my general doctor, and
Sure.
it's really seamless how they can communicate with each other.
Sure.
And my specialist might say, I really need to see him.
Right.
Well, then they relay that information. And
Sure, yeah.
I get in.
Yeah.
So it's really that continuum of care that is very important.
Continuum of care. Thank you so much for your thoughts. I appreciate that. And I want to thank all of my panelists today, Rob June, Terry Walling, and Jason Nuttall. Thank you so much for joining with us today.
Thank you, Justin.
And thank you for watching Wisconsin Doctors. That's all the time we have for today at Mile Bluff Medical Center. From all of us at Wisconsin's 57, we invite you to live longer, live better. We'll see you next time.